Thank you so much, and thank everyone for braving COVID and coming out. And I am just so excited to share my passion with anyone, and honestly to see the top-notch facility that they have put together, and to be able to hand a baton to them, for them to plant a seed and start something, for me is just beyond exciting, because you guys, I applaud you both for the facility that you've created. It's safe, it's as good as hospital or better, and that's the type of facilities that we need to keep Hyperbaric going instead of stalled out like it has been for so many years. But I have 105 slides. I talk quickly. We don't have to see them all, but let's get started so that we're not here past dark. But full disclosure, I do have a little guy showing the pictures that I got off the internet without necessarily giving someone credit. But I want to share a little bit of my background, a little bit of what hyperbaric is and why it works, because I remember sitting in the lecture hall in medical school with a physiology professor saying, unless you're under hyperbaric conditions, but you never need to know about that. Next slide, please. That was, we won't count how many years ago, but that was my training for hyperbaric. But I've really gotten to understand the benefits, and am so excited about, oh my gosh, what else, what's next, what more can we do? My training was general surgery at Tampa General. I was there before this beautiful wing. We had mattresses on the floor in call rooms that were way down the hall in the early 90s, but a training that was unbelievable. I spent every other night call, trauma surgery. We had countless head injuries come in. If they were unconscious, the neurosurgeons would put a bolt in, and once the bolt was in, we would stand and watch and know that we couldn't do anything to help them as we watched their intracranial pressure increase as their injury progressed. And if you look, this is a picture that I got off the internet. I have no idea who this is. No idea who posted it, but the head of this patient's bed is elevated. So clearly this patient actually is having increased intracranial pressures, because that's what we did, which we now know is totally wrong, in the 90s, was elevate the head of the bed, put them on pressors or to try to decrease the blood flow to the brain, to decrease the swelling so that they wouldn't herniate. And if they herniated, we called LifeLink, one of the organ donors, and we always knew, you know, this person is spiraling, this is going to be next, this is the call you're going to get. We'd see the donor coolers come in. It was a travesty. Now, 30 years later, we tend to be more proactive with head injuries, and I also have a clinic in Northbrook, Illinois, and it was all over the papers that when Senator Mark Kirk, before he was senator, had a carotid dissection, he was taken downtown to Northwestern Memorial, and a section of his skull was taken out to allow his brain to swell. And from a medical perspective, that's compartment syndrome. And compartment syndrome is an FDA-approved indication for hyperbaric oxygen therapy. So there is a small crack in FDA that we may be able to slip in concussions if we can get enough compelling data. But I finished surgical residency in 2000. And fast forward to 2009, I changed careers, giving up general surgery because I'm fortunate to have 6 children. And as a mother of 6 children, when I went through my slides, my kids said, "Oh, Mom, you've got to warn people before you show those gross wound pictures." And I didn't think they were that gross, but the teddy bear is to warn you all that I'm going to show you some wound pictures, compliments of my children. In 2012, I treated a young girl with frostbite who likely would have progressed to lose both of her feet. And here's a before, and here's obviously the now after. We drained 8 fluid ounces of fluid from her blisters on Thursday after we started diving her Monday morning because she was developing foot drop from the weight of the fluid. But it's hard to see in this picture, but you can see some blue discoloration spots. This was before hyperbaric, and this was after, but I didn't want to disrupt her blisters. But there's nothing like Fargo, North Dakota on New Year's Eve with a little bit of alcohol, and I believe the temperature registered minus 22, and that was without the wind chill. The first year I was there was record setting, so I was proud to say I survived the winter of 2018. But this gentleman, the wound center cut off his blister, which makes for fabulous photos of before and after. And you can see the blue discoloration, and that is swollen, dying tissue that we got back with just one hyperbaric treatment. There's improvement in his tissue. After one hyperbaric treatment, this young gentleman did not need another opioid, which is another incredible advantage of taking care of injuries, to not allow for drug addiction. And I want to point out, look at his big toe. He had a lot of bruising and red blood cells under his big toe that if you look at the post picture, it's not purple at all. He came back in my office on January the 12th because his mother made him come back home from college to buy socks and winter boots. And you can see that he has epithelialized his entire area. He was walking around in socks and a tennis shoe 12 days after a frostbite to that extent. But you see the bruising of the big toe. I didn't open that up to drain it, but that's just from bruised tissue. And bruises are my way to show physicians how high we can get tissue oxygen to the areas. This is a gentleman we were actually treating for a head injury who fell off a ladder right before coming into the clinic, was on a blood thinner. You see all of this purple bruising. We did just the brain 1 hour treatment, and you can see on your right side all of the red areas that the bruised, deoxygenated blood has turned red and become oxygenated blood, because we got the tissue oxygen level so high, there was oxygen to oxygenate those red blood cells. So we can get tissue oxygen levels to 1,000% higher than what they were, or at least the plasma of the blood. So we get these great tissue levels, and this is a bruise showing that. My other enormous fascination with hyperbaric is inflammation. This is a lady who had pyoderma gangrenosum, which I had to look up 10 times to learn to spell, but it's a progressive injury, disease, inflammatory process that usually, she actually had a wound for 3 years prior to when I met her that was on her ankle, but she started developing a new wound on her finger, and in less than 1 month you can see that she has completely resolved this. And if you look at the first picture, her index finger is like a sausage. But if you look at the final picture, you might be able to see and make out the veins, because she does not have any residual swelling that you couldn't even see in the swollen, inflamed finger. And this was with no other additional medications. She couldn't take Remicade or any of the other steroids or any of the other anti-inflammatories. So the wound pictures are over. This is Dr. Ken Stoller. I took this off of the treatnow.org site. But the point of hyperbaric is we're not oxygenating the red blood cells. Under a normal condition, those are fine. What we're doing, represented by the white dots, is we're driving more oxygen into the liquid portion of the blood. And why is that important? Normally, all tissue is within an arm's length of a red blood cell in a capillary that can download oxygen to it. And I explain it a lot, saying it's as if Amazon is going down the street delivering packages to every house, and the driver can run to each house and deliver a package, and every house gets what they need grocery-wise. And think of that three-dimensionally. So you've got red blood cells allowing oxygen an arm's length to all the tissue. But when you have an injury, it's as if the entire street for blocks is blocked off and the truck or the red blood cell can't get through. But if we can have 100 drivers, or as Grant said, if we had 100 drones that could take packages so the truck can stop where it needs to, but we still get the packages delivered. With hyperbaric oxygen, we can take injured tissue and deliver oxygen to that injured tissue, to that injured, potentially dying tissue. I have cells in the middle that are dead. Dead is dead, it stays dead. Hyperbaric does not bring back dead tissue, period, no discussion. But viable cells need ongoing oxygen supply. Cells that are injured, that are cut off from oxygen, can only remain viable for so long, or they might remain alive but not functioning at their level. And that's what we talk about a lot with concussions. But with hyperbaric, we can establish enough oxygen that we can get those injured cells back to healed cells. The other really important aspect of hyperbaric, especially for concussions, but for many other things, is the reduction in swelling. So normally what goes in comes out. And what's represented by the yellow is lymphatic flow. It's not an appropriate representation, but the arrows are the same. In equals out. We know with injury, we have a dramatic increase in the flow. We have vasodilation in injured tissue. And we have a lymphatic leak. So we have all this boggy, swollen tissue. If you've ever seen a sprained ankle, it just balloons up in front of you, also with a lot of bruising. But the tissue is thick because of all of that extra fluid. So we can't change outflow, but with hyperbaric, we can have vasoconstriction. So there's less inflow, therefore less leakage. So a net effect of increasing outflow, and we can see a 20 to 30% reduction in swelling. And those are the patients that in the chamber, like for a swollen ankle, we do a 2-hour treatment. And the last 30 minutes in the chamber, the kids are in there doing a tap dance, and they're like, oh my gosh, I can move my ankle. And it's surreal that in that period of time to have that dramatic a physiologic effect simply because of the reduction in swelling. And again, it is swelling that causes compartment syndromes. Compartment syndromes are FDA approved as an indication for hyperbaric oxygen. The third aspect that's so important for concussions and fascinating to me is the reduction in inflammation. And the bottom line is the body was designed to take care of itself. When you don't have oxygen, cells turn on, inflammatory cells turn on, they produce proteins called cytokines that kind of stir the pot and create even more inflammation. And we get this just cascade. And with COVID, that's become even more, it's an inflammatory process. The body was designed to have cells that turn off the inflammatory process, but it turns out those cells need even more oxygen, so that if we reach enough oxygen, the body can turn off inflammation the way it's supposed to. And that's what happens with hyperbaric. Unlike steroids or other anti-inflammatories that are a shotgun, that disrupt the body's natural balance, we're turning off inflammation the way it's supposed to be turned off. So, the mother of 6, I've been rinkside, I've been courtside, I've been waterside, I've been poolside, and as a surgeon, knowing brain injuries and then seeing these kids, my kids' friends, who have life-changing injuries just from 3 volleyball concussions, or from 1 hitting the board doing a back turn swimming, or an oar that they're loading on the trailer that hits them, and they're homeschooled and their personality changes. And I'm sitting there as a mom thinking, what is going on? So I started looking at concussions. We know it's a problem. 3 million a year. You Google it, and the answer is no specific cure. This enormous group of individuals, and I know several of them, got together and came up with a consensus statement, and they did this cute little everything starts with an R. And the only thing close to treatment is 2 paragraphs on rest. And they say rest may promote recovery by minimizing brain injury. So energy. What causes energy in the human body? It's oxygen and glucose. But then they say we don't even know that rest is, the total rest solves that objective, needs further study. And that's the treatment for the consensus statement in 2016. But what really got me was when you look at everyone that's a proponent of return to activity, return to physical activity sooner, is that they say boost in oxygen flow associated with exercise. So the whole reason to no longer go in a dark room, stay in a dark room, shut the door and do nothing is to get out, walk around, although I've known concussion doctors send kids back to school, and there's a huge difference between mental rest and physical rest. But the whole reason to not do physical rest is to increase oxygen flow to the brain. Thank you for that phenomenal help. Neurons, brain cells function, I call them the Michael Phelps, whereas I am the bench warmer. Brain cells need 5,000 calories a day, like the big McDonald's commercials with Michael Phelps when he was winning all of the gold medals, as opposed to those of us who are not doing as much physical exercise. So when they already need an enormous amount of oxygen, and then they're injured, they need even more oxygen. Concussion doctors will say, oh, but 90% are better within 14 days. Really? What's better? Because the CDC, I think it took them 5 years to complete a study to Congress, showed that 14% of kids a year after a mild traumatic brain injury or a concussion, mild injury, 14% still needed academic help. How much taxpayer dollars are going to help kids get their education after a concussion? Education's extremely important, don't get me wrong, but 30 to 60% of the kids 1 month after injury still had symptoms. And we know that childhood concussions, hidden epidemic, they can lead to cognitive and behavioral problems. There was a study in September of 2018 that showed that 58% of kids with a concussion still met post-concussive syndrome, still had more than 2 symptoms at 28 days. And I emailed the guy and I said, at 28 days, really? At 6 weeks, it looks awfully high to me. And he said, yeah. And he pulled up the data and he said, yeah, at least a third still have symptoms at 6 weeks. And at some point you get to, okay, that's a year of having symptoms from a brain injury. And then there's always the heartbreaking story that you read to about paragraph 5 of the story. Kelly Catlin's father said that he feels like her suicide could have been prevented. She was an Olympic silver medal cyclist getting a graduate degree at Stanford. What an incredible, driven, successful individual. And she committed suicide. And he said she likely had 2 concussions. And after her second concussion, her father said she was not the Kelly that we knew. She would talk like a robot. And we've all seen it, if you've seen people with concussions. And he said, you know, what happened to our Kelly? She committed suicide. A Juno hopeful. You read down, and the father donated his brain to Boston University. Well, that's an automatic trigger. We know why the brain went to Boston. And the coach said, but he was treated for his concussion and able to come back. But the symptoms for a mild traumatic brain injury, and we were discussing it earlier today, they're so vague and so, you know, of course you're tired, you're an athlete, of course you have a headache, you're dehydrated, of course you're not focusing like you were, it's this, it's that, it's 15. We excuse away these symptoms. But behind the symptoms are real changes in the brain cells, and those changes need that brain cell to have the energy to undo those changes. And they've documented the changes very well, and they have shown, if you can see on the bottom on the dotted line, that the brain has decreased blood flow for about 2 weeks after even a mild brain injury. So when we need more energy, we're getting even less to brains, and whether it be the brain of a newborn or the brain of a veteran or the brain of someone in a car crash on their way to work or on their way to see their grandchildren, brain cells need more energy to repair, not less. So what if we could stop the progression of that injury? What if we took an aggressive approach of what I've called treat a concussion? So UVA actually just published in Nature an incredible article that is such a gift to my passion of let's treat every concussion, showing that even mild injuries can have dire effects on the brain. When I first started this, I saw a senior high school player knocked out on the field, carried off the field by ambulance, diagnosed with a concussion. His doctor said, call Denham. He was in my clinic by 2 o'clock on Saturday after a Friday night football game. How are you doing? I'm fine. I kind of don't know why I'm here. I'm okay. You know, the FACES scale, how's your headache? 2 out of 10. I'm okay. We said, okay, you're here, we're here, let's do a treatment. Bring him out. He stands up, big guy, 6'2", I think, because when I look up to someone, you know, they're over 6 foot. And he goes, wow, I was messed up. We can stop a brain injury, and kids don't even appreciate how injured they are. Another patient, a soccer goalie, was already wearing sunglasses and taking baby steps from his 8 p.m. game the night before when he was hit by another player and then hit the soccer goal post. He had a treatment, another treatment in 36 hours, and that's all he needed. So within 2 days, instead of progressing to the peak of his injury, we already had him concussion symptom free. And I keep in touch with his mom, and he's not had a repeat concussion. So he never knew the extent of his concussion. But keep in mind, we were swimming upstream. Concussions make a lot of money. With all due respect, it's very difficult to stop something that is a stream of constant patients. So in 2018, July, I was fortunate enough to open a clinic in Fargo, North Dakota, and we started a study called Treat a Concussion. We had a donor put up the money so that if I told a patient, you need another treatment, the patient, the parents didn't have to pay. So we treated 144 concussions I think we had 3 patients that came back for a second concussion. We had 99 males, 42 females. And at 1 month, we sent a survey monkey, and if they didn't answer that, we sent it by slow mail, and if they didn't answer that, we called, and despite all that, we still had 35 no answers. But 103 of the 144 were completely symptom-free at 28-day follow-up, and only 3 still had symptoms. 2 of the ones who still had symptoms lived so far away, despite being able to stay at the Ronald McDonald House, they needed to get back to the farm, back to work, etc. So we knew that they were still concussed and were not what I call sustained symptom-free. So 2 of our 3 we kind of knew were failures. So I consider one that we had a true failure. She fell down 3 steps, concrete steps, in an arena, and her mom said, I watched her head hit 3 different concrete steps. She had 17 treatments. She was tired of coming in for treatments, still having some symptoms, but she wanted to get back to school. And she actually came in later to do some more treatments, but that was after she went on summer vacation with the family and she was living life. And if you're familiar with post-concussive symptom scales, her symptoms were actually not that bad. And she had some more treatments. We had 3 repeats, and there's nothing like somebody to screw up your data. 2 football players and a hockey player, they had had so many previous concussions that as soon as they got hit, they were in the clinic the very next morning because it was the I'm not going there again. And I'll show you how they messed up my data. But of the 144 concussions, so that patients were not responsible for how many treatments they needed, and this is as close to honest data as we can get, we found an average of only 3.8 dives were needed. Let me clarify, apples, oranges, tangerines, and whatever, avocados, these are acute concussions, 7 days from injury or less, not still having symptoms from a previous concussion when they are hit. A concussion on a concussion is very difficult to treat. It's a completely different injury. So we did select out acute, not symptomatic prior to this concussion. They could have had more previous concussions. So are repeat concussions worse? And we looked at it, and this is where I said nothing like somebody screwing up my data. The 2 guys who'd had 6 previous concussions came in less than 24 hours, and they both had 1 treatment. So it looks like if you've had 6 previous concussions, you need fewer treatments. But we statistically have not found that previous concussions are that much of a problem. This is the slide that I am most excited about, and I am most excited about passing the baton to Charlottesville because 74% of our concussions came in 4 days or less. We, through this foundation and through this study, were able to change the mindset and the standard of care for concussions in Fargo, North Dakota, western Minnesota, all of North Dakota, because we had over 100 patients come in less than 4 days with the mindset of, I have a concussion, I'm going to get a treatment. And that's what I can't wait to see your all's data a year and a half from now. We had more males than females. Females tended to need more treatments. We know females tend to have worse concussions. There's all kinds of reasons why. I won't even get into that. That's a whole nother talk. But we did have 31 patients that would have been classified as very high risk for a very prolonged recovery because they admitted on their intake form having either ADHD, a learning disability, anxiety, difficulty sleeping, multiple other issues. So we had 31 patients that would have been very high risk, and fabulously, the average of those 31 patients was still just 3.8 treatments. So if we can get them in and get them treated before their concussion progresses, then we can help even these high risks. We had 2 patients that we treated their concussion, but in follow-up, the mom said, they're still just not right. And so both came back in. One was a hockey player whose concussion was close to Thanksgiving, and he said he was symptom-free, but I was a little leery. By January, he didn't want to get out of bed, didn't want to go to school, was not having any other symptoms other than depression. And everybody's like, drug. And mom said, let's try hyperbaric again. He came back in, he had more treatments, straight A's at the end of the semester, and set a state track record off of drugs, never on drugs. So his depression clearly, in hindsight, was a result of his concussion. And so, what's better for kids? Pure oxygen? We'll see. Complications. We had some minor complications just with ear pain. We had 4 patients who were not able to go to the depth that I wanted them to go to, the eureka depth actually for the concussion protocol. And interestingly, the first patient who couldn't was the niece of an ENT. And she said, she's had trouble with her ears, I'll just put tubes in. And I'm like, I've died and gone to heaven, because you recognize that tubes in the ears is so much less concern than a brain injury. She put tubes in, she had treatment, she recovered from her concussion. The ENT said, next time I don't think the patient would need tubes. Just call me and we'll do needle pokes. So we had 3 other patients, and the next patient actually, fortunately, had traveled a significant distance, and they were, of course, we want needle pokes in his eardrums because we came all this way, we want treatment. He had needle pokes, tympanostomy if you want the formal word, but he was able to do all of his treatments, and they were able to travel back to home. So we now have gotten that accomplished in my Northbrook clinic, which we could not have done without having the Fargo experience. But concussions are a functional injury. They're brain cells that are still alive, that are Michael Phelps benched, not dead. So CTs, MRIs, the run-of-the-mill routine diagnostic tests don't show it up. We need something to show function. Fortunately, in Fargo, Dr. David Bieberdorf is a sports vision optometrist. He's a general optometrist as well, but an emphasis on sports vision. And he worked with a company called Right Eye. And they recognize that 80% of our sensory information comes in through our eyes. So I call it the canary in the coal mine. The Right Eye test, and I'll go through some different slides, is 7 minutes in front of a computer screen with the patient just following the cursor and just following the instructions. 7 minutes, no radioactivity, a computer screen that can be in your office. Can it be any nicer? A 13-year-old, concussion on Thursday night. I saw him Sunday afternoon, and he scored a 37. This is a composite score. Functional for his age is 55 to 75, and he's a 37. We treated him 4 days, and 4 hours later, he went from a 37 to a 78. 4 days and 4 hours later. His vision is dramatically better. So the data from using Right Eye, they look at multiple different things. For the composite score, the pre-test was an average of 50, post-test an average of 61. But what's most important is the statistical significance is 0.000. Highly statistically significant. This isn't just by chance. There is a dramatic improvement. So looking at it, what they're supposed to do is follow a circle. And what the computer does is pick up how the right eye follows and how the left eye follows. And if you look, there's periods of time, the right eye goes over here, the right eye goes down here. Afterwards, and the left eye is not going there. So this is not a test that an athlete can come in and fake, because they know that if they fake it, then they can play again, because concussed, they'll still be about the same as if they fake it. So it tracks the eyes, but afterwards you can see he's much smoother. On the line, how often it's smooth instead of jerky movements, and their efficiency, or how far off the line they are. But all of those for the circular pursuits, for a vertical and horizontal pursuit, are statistically significant 0.000. So we have data. A fun slide to see, they're supposed to be staring at an X on the screen, and they should be within this circle, and they're way off. But then after treatment, they're staring where they're supposed to be. So a football player, before one treatment, he was 48. 1 hour and probably a half later, he was already 62. We didn't test everybody right before and right after. But 24 hours and 3 treatments, concussion resolved, he was 77. Friday night concussion, he was in homeroom Monday morning, participated in school all that next week as if he were not concussed. Our failure went from a 37 to a 50, so some improvement, but ideally she would have been even better. So our data shows that HBO works, and so the question is, why not treat? Well, of course, everybody says, well, because it's expensive. So if you look at an average of 4 treatments, and if you look at the Medicare reimbursement, which is what so many things are based off of, Medicare reimbursement for 4 treatments, and granted our average is 3.8, which would bring it down, but let's overestimate, $1,500 per student. Well, what does that mean? If you look at this was out in Clinical Journal Sports Medicine 2019, the economic burden of pediatric post-concussive syndrome. They had 62% who were post-concussive, and the post-concussive cost per student was more than $3,500. So now, the math geek that I am, if we treat every one of their 247 Medicare rates, it would be $372,000. If we just look at what their post-concussive, or their 154, at their average cost of $3,500, it was over $500,000. Granted, they may be using private insurance rates, which are not Medicare rates, but there's a significant cushion there for cost, not to mention kids are better. So forget that kids need to be better, it's cost effective. Another study was looking at, I think this was Blue Cross Blue Shield, looked at their data of head injuries and found that, I was doing their math, that 1.6 million, 81% is almost 1.3 billion, and of their percentage of patients, over 500,000 were mild, and that turned out to be $2,222, and that's already 10-year-old data. So even with their 10-year-old data, and Medicare has increased the reimbursement for hyperbaric, it's still cost effective to take a treat-all approach. Well, what's the medical concept of treat all? All the backlash I get is, well, you're over treating patients. Oh my goodness, with oxygen. So medical standard, if you have strep throat, you get an antibiotic, period, no discussion, standard of care, malpractice if you don't. 0.5% get the kidney glomerulonephritis or the mitral valve issues, endocarditis, etc. So we are totally accepting that we're over-treating 99.5% when we have antibiotic resistance of strep throats with an antibiotic. The general surgeon that I am, if you go to the OR to do a colon resection and that patient doesn't have antibiotics on board 30 minutes prior to your documented incision time, you're in the principal's office. That is standard of care and the hospital gets dinged. Why? Because 10% of colon resections have a wound infection. We, if we have antibiotics on board, can decrease that to 2 to 3%. So we're only helping 7 to 8% of patients when we aggressively treat 100%. So we're over-treating at least 90, if not 93% of patients with antibiotics. IV antibiotics, we have anaphylactic reactions, we have the expense, etc., but it is malpractice if we don't treat everybody. So there's a medical precedence for treat everybody. And I tend to say, how can we afford not to treat these kids? There's documented risk of suicide after concussions. I treated a college student who kind of just showed up with his parents and was in my clinic, and he said, you know, he'd had a concussion, so we got him in the chamber, and his parents were talking, and they said, when the house is quiet, we go look for him, and we're scared to death of what we'll find, because he had expressed being suicidal. He was an honor student in high school. He was on full Division I hockey scholarship. He got a concussion. He failed out the first semester of his freshman year. So he comes home, and with a brain injury, and he's a failure, he's looking at, there's no hope for me, because his brain can't comprehend anything in the future. When he came in, we treated him, and the next day did a right eye. So he was a score of 70, which, if you'll notice, is within the functional range. And we find that our elite athletes with a concussion fall in the normal range because their brain-eye reaction time is so off the bell-shaped curve. But I put on here somewhere 4 days later, I think, but we treated him. He was up to an 86, and he is one of many patients that I cherish the moment when he was leaving the clinic after his last treatment, and he said, "Thank you for my life back." He was taking summer school classes. He was excited. He was looking at the next fall semester, and he was ready to re-enter life instead of sitting in his room contemplating ending his. Here's an adult, 21, and I put this up here. Look at his stability, if you can see it. I don't even think he got a dot within the circle. 4 days later, he's a 77. He was actually a wrestler and had had some hyperbaric somewhere else a few years earlier, but noticed he was getting bad again, was suicidal. I got a call from a friend of a friend. I said, get him to Fargo, we'll treat him. And to go from can't even function, I mean, if you look at his left eye, he never hits like a clock face from noon to 5 p.m., never even hits it. He's way off. 4 days later, he's on track so much more, and he's looking where he's supposed to be. Such a dramatic change in so little time. Here's a 31-year-old 6 years after an assault. And we were only doing a treatment for him once a day, so his right eyes, this was very early when we were doing it, his right eyes were 21 days apart, but from a 38 to a 79. When he first took this test, I looked at him and I said, dude, you are tortured from the time you wake up in the morning until the time you go to bed, because all you want to do is see one thing instead of two. I mean, look at this. This looks like spirograph when you get off track. And he started tearing up and he said, nobody understands. Everybody tells me you're fine. Just get up and go. So then his brother was in the clinic with him when he came out with the sheet after his treatments, and he was grinning from ear to ear, and his brother teared up. And he said, I can't believe we didn't appreciate how bad he was, and I have my brother back. Better lucky than good is such a surgeon phrase. We had an NHL player, first year in his contract. Don't let my coach know, don't let anybody know. Dude, don't worry, your name is John Doe. Well, I'm bringing a friend. Great, your friend is Buddy Doe. So John Doe and Buddy Doe show up, and John Doe and Buddy Doe have 6 treatments, but Buddy Doe has a cold and can't get to the depth that I wanted him to get to, and we didn't have him go have his ears poked because it was a holiday weekend. But John Doe, NHL player, went from a 68 to an 86, and the only reason he wasn't a 99 is when he was supposed to be staring, he was so, I can't believe how much better I feel, I can't wait to get back on the ice, blah, 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 blah. And if you look, his fixation score is a 25% because he wouldn't hold his head still, and this was the 4th time we did it, and I was like, dude, I'm done with you, you're better, move on. But Buddy did not improve. So I have an N of 1 showing that my deeper depth probably really does turn off inflammation more. I don't want to do the controlled study. Here's a patient early on, scored a 7. He's the lowest, other than some patients that couldn't even finish it because the machine couldn't pick up their eyes. But again, a spirograph. Straight A honor student in an honors private school, had a concussion, didn't want to tell anybody, football practice, got a second concussion the same week, and came in, and this is what he was. Halfway through his treatment, he improved to a 60. He actually ended up having 15 treatments. He's not in the data because he was a concussion on a concussion, but finished the semester, straight A student, participated in the basketball season. Haven't heard from him for 2 years now, so clearly he's not been concussed again, or I guarantee you he would be back in the office. And patients, when we get to that deeper depth, say, oh my goodness, the cloud's clear. And I'm going to go through these slides quickly because I've said enough and pictures are worth 1,000 words. But a concussion on a concussion in a rat looks like someone just took a huge bite out of a loaf of bread. But if we give hyperbaric right after the first concussion, before the second concussion, there is statistically significant when somebody filled in with color and then they counted the color, statistically significantly less injury. So everybody that says you don't have data, we have all kinds of data on rats, and now we've got the right eye data. But Dr. Zhang's group, they're the ones who did the rat study, have shown that we have improved oxygen delivery, enhanced oxygen extraction, improved blood-brain barrier, we reduce brain edema or swelling, improved metabolism of glucose especially, and we inhibit inflammation. And they have all of these markers to show. So we treat the problems with a concussion. In mice, immune activation promotes depression, less than 1 month. Research ties inflammation to post-concussive symptoms. Microglial priming, we'll just rush through this. Patients get subsequent concussions. 4 times more likely to experience another concussion, 3 times more likely to have it in the same season. concept of a concussion threshold. But microglial activation induced by traumatic brain injury is suppressed by post-injury treatment with hyperbaric oxygen therapy. But that study came from China. We don't believe anybody in what they say, and we don't want to believe mouse data. The limbic system is the emotional system. The limbic system is a very vulnerable system that is next to hard surfaces of the brain. So it is very understandable why, no matter where you're hit, how you're hit, what you've been hit with, that the emotional, behavioral, motivation, long-term memory, and even smell are affected. So many concussions funnel down to similar symptoms because of limbic system involvement. John Zhang's lab also showed that not only are blood vessels decreased, you can see this is normal, this is after a traumatic brain injury in the other side of the brain. So again, global brain dysfunction when the brain's been injured because of the closed compartments. So why not treat a concussion? Faster recovery, decreased chances of subsequent concussions, decreased chances for long-term problems, and it's cost-effective. So my last bit of information is kids don't appreciate the level or the significance or the amount of injury. This kid was a farm team NHL player, came in, how's your vision? I'm okay, scored a 32. Post-injury day 2 at 2 o'clock was this one. Post-injury day 4 at 4 o'clock. So we're looking at 50 hours later. He goes from a 32 to much more appropriate for an NHL player or farm team player, 82. And Dr. Bieberdorf was there and he said, so how's your vision? He's like, great, I can see. And Dr. Bieberdorf said, but you said you didn't have any vision problems when you came in. He said, dude, I didn't even know I couldn't see. They don't know. So we need an education piece to, when your friend is not your friend anymore, you need to say, dude, you've had a head injury, there's a treatment. Call Charlotte Hyperbaric, if I can plug you guys. In Fargo, we were the 5th pilot site for VA using hyperbaric oxygen to treat PTSD and traumatic brain injury. I am ecstatic to say that's been extended for an additional year, and I am enormously hopeful that the pilot sites won't stop at 5 and that we can increase the number of pilot sites. So, 2019 is already over. 2020 is already half over. We continue to go down the journey, but I'm ecstatic that Charlottesville can start to do what we've been doing in Illinois and what we've done in Fargo, North Dakota, and I can go back home and these guys can take over and we truly can continue the concept of treat a concussion. Give oxygen to the brain when the brain needs oxygen. Decrease the swelling of the brain when the brain is swollen, even if it's not so much they need to be hospitalized, it's still swollen. You stub your toe, it may look fine. You wear high heels, it hurts like heck, so you put the house slippers back on. We don't have high slippers for the brain. We need to get the swelling down and we need to turn off that inflammatory process. And that's why the article out of UVA is just a gift showing even a mild injury turns on inflammation and sets the brain up for significant problems. And if we can change the concept to overtreat, oh my goodness, with oxygen, then we can do so many more things in addition to taking care of veterans. We can take care of kids, we can take care of adults, and we can keep brains functioning the way God meant for each individual brain to function. We're not going to make Einstein out of somebody, but if we can keep everybody with their God-given brain, then we've done something. So, any questions?